So looking at another assisted vaginal delivery, this is what is known as a vacuum extraction. Vacuum extraction. So vacuum extraction, this is the vacuum, so it is placed on the head of the baby. So they kind of like help to like pull the baby out. This is another method. Alright. So you should know the difference between vacuum extraction and forceps delivery is different. Okay. So for this, we said that vacuum extraction is also known as vacuum assisted vaginal delivery. It's a technique used during childbirth to help deliver a baby when the labor isn't progressing, right? So when labor isn't progressing, you might just want to actually bring up a method that are actually helping to like drag the baby out. So what is involved is it's a soft, rigid suction cup is placed on the baby's head, right? The cup is connected to a vacuum pump that creates suction. So during a contraction, the healthcare provider gently pulls while the baby pushes. So pulling from outside, pushing from inside. It will now help to guide the baby through the birth canal. So when is this method used? Alright, so it may be considered when labor stalls in the second stage. So the mother was actually having a successful labor, but it paused. If the baby shows signs of fetal distress, the baby doesn't really have strength, the mother is too exhausted to keep pushing. If there's a need to shorten the second stage of maternal or fetal, like you are shortening the second stage of delivery, right, for health concerns of the mother, health concerns of the fetus. So when it's not recommended, if the baby is preterm or not yet descended into the birth canal, you don't initiate this. If the baby is in a breech or abnormal position, if there is a known bleeding disorder, okay, so if the baby is suspected to be too large for vaginal delivery. So risks and considerations is for the baby, scalp bruising, right, cephalohematoma, it's a collection of blood under the scalp. So for the mother, if there are some vaginal tears, perineal tears, so why it matters is it can be a safe alternative to cesarean delivery in certain situations, and it's often preferred over forceps. This is due to what? There's less maternal trauma. Forceps is so big, forceps is so big, but this one, you just put it and it's just one stuff like that. So that's just it for these ones.